Hepatitis Education Prevention Program, which is a community-based hepatitis prevention model targeting vulnerable immigrant and refugee communities. This webinar will be about 20 to 30 minutes long, followed by a Q&A session, also for about 20 to 30 minutes as well. Typed questions will be allowed during the webinar, and for those of you who are unfamiliar with GoToWebinar, click the red arrow on the right-hand side of your screen, and this will open up your control panel. When you want to ask a question, click on the Raise Hand function directly below the red arrow to alert the moderator you have a question. You can then type in your question in the section labeled Questions Chat, and we'll do our best to answer as many questions as we possibly can during the webinar. If you have any problems with this sound, please remember that you can also listen to this webinar over the phone at 951-266-6131. Again, that's 951-266-6131, and the access code is 179-057-164. And you should have also received this in an email when you registered and in your reminder emails. We will be archiving this webinar on our website. We'll make sure to include the link in a follow-up email as well. So my name is Mona Alshaman. I'm the Hepatitis Program Manager at Asian Health Coalition, and I'll be facilitating the webinar today. I'm here with Dr. Kim, Professor of Medicine at the University of Chicago and the Board President of the Asian Health Coalition. She'll be joining us for the Q&A session. By the end of the webinar, it's our hope that so by the end of the webinar, it's a hope that you have background on Asian Health Coalition and health disease burden, understand the significance of multi-sector relationships, that you distinguish the roles of multi-sector relationships, and that you've gained insights into Asian Health Coalition examples of these relationships. And we hope that you obtain a working knowledge of the tools available online. Asian Health Coalition was founded in 1996 with a verdant mission to improve health and well-being of Asian American and Pacific Islanders through advocacy, technical assistance, education, and community-engaged research. We do this by identifying causes of health disparities in our community and developing strategies to reduce them. Through lessons learned and successes, we begin to establish best practices and themes that work with our communities. And because it's so important to share these best practices with others doing similar work, we disseminate models such as HEP through manuals, provider presentations, public service announcements, and webinars. One of our oldest and longest lasting programs has been Hepatitis B, which impacts Asians disproportionately. In the U.S. alone, 1.5 million people are infected with Hep B. And half of those, 750,000, are Asian or Asian American. And of those, 75% do not know they're infected, which illustrates the danger of the disease. As many of you know, Hep B is asymptomatic, so people can go through their entire lives without knowing they're infected until they experience liver damage, failure, and sometimes even cancer. It's also important to note that 65% of all Asian American Pacific Islanders are foreign-born, which ultimately shifts this global burden of hepatitis B from Asia to U.S. Asian populations. As you see, there lies a disproportionate disease burden among Asian Americans. There is a lack of surveillance data since not all cases are reported, and there's little information about how many people are infected. And there's a lack of awareness and education about the disease, especially for immigrants who come to the U.S. as adults. For those who are school age, they're required to get vaccinated to stay in school. But for the rest, so adults, 18 and above, there's no requirement to get a vaccine. Because people know so little about Hep B, there's a lack of interest to prevent it, which ultimately results in this perfect storm. In order to help tackle this huge disparity, Asian Health Coalition has been implementing our HEP program for over 15 years. In order to make the program successful, we know that it was crucial to develop solid partnerships with key sectors. We've highlighted 5 key sectors today that we'll be discussing throughout the webinar. We'll discuss the importance of building these specific partnerships and share examples of how we've all benefited from these partnerships. We'll talk about the relationships we've built with our local government, academic partners, community-based organizations, local ethnic media, and healthcare providers. We'll begin with government. So since the government's interested in improving health and health access to the community, it's crucial to engage the local government in all our efforts. Not only do they have resources that can help provide funding and support, but we can also help advocate through our partnerships. Local governments often provide funding for community-based hepatitis education outreach. For example, recently the CDC has recently funded the Chicago Department of Public Health to provide vaccines for at-risk communities, and we've been able to partner with them, providing those who are susceptible with vaccines. They also collect and analyze valuable surveillance data for community mapping. And lastly, having the local government support and attend your events helps raise awareness in the community and helps strengthen your efforts. During Hepatitis Awareness Month last year, in 2012, we partnered with University of Chicago to hold a hepatitis leadership breakfast dialogue in which Senator Danny Davis spoke to the hepatitis B burden and about our HEP program. The dialogue brought together leaders from the state, city, and local counties to discuss the Public Health Department Department of Health and Human Services action plan for the prevention and treatment of viral hep. So next I'll discuss academic partnerships. In order to develop strong, solid, evidence-based programs, it's crucial to build partnerships with the academic community. And it's also important to note that the number of research partnerships between nonprofits and academics has increased dramatically over the past 20 years. Our board president, Dr. Karen Kim, has helped provide us with resources that have helped improve our programs. Academic partners are able to evaluate content and validity of educational materials, assist with developing surveys, and help with strategizing our program. The University of Chicago has helped us in all these ways over the past decade, and they've helped evaluate our content, ensuring that it is culturally and scientifically appropriate, and they've helped create client surveys to assess knowledge and attitudes, and lastly, they've helped develop a process flowchart that's helped us to define our activities and identify gaps and opportunities in our program. Here are just a few examples of some HEP education materials that the University of Chicago has helped us with. On the left, you see a pre-post test survey that assesses the knowledge of community health workers before and after the training that we provide. In order to best serve their clients, it's very important that the community health workers fully understand hepatitis, how it's contracted, prevented, and treated, especially when they have the closest contact with the participants, and clients often ask them questions directly about hepatitis. The other two documents on the page are hepatitis education materials given to participants at hepatitis B screening and vaccine events. Our academic partners have evaluated them for their cultural and scientific appropriateness, and the one below, the ABCs of HEP, has been translated into several key Asian languages. The one here is in Chinese. Our third sector that I'll talk about is partnerships with community-based organizations. Of course, partnerships with our community-based organizations have been instrumental in implementing our programs. The CBOs have the ability to influence attitudes and behaviors of their community members by building on relationships of trust and respect. When first developing our partnerships with our CBOs, they help us to identify, recruit, and train the community health workers, who then work with us to implement the program. We also conduct organizational capacity assessments for our partners, which ultimately allow us to understand their readiness as well as their strengths and gaps, which must be understood in order to implement the programs effectively. Lastly, because our CBOs understand that their communities best, they help develop framework and protocols for conducting the screening events and ensuring that they're culturally and linguistically appropriate. Here you see a list of our valuable partners who we've worked closely with throughout the program, as well as a couple photos of our screening events. When developing hepatitis education awareness materials, we often turn to our partners to let us know if what we're creating is appropriate and if it's appropriate for their community specifically. Through our conversations, we learned that different approaches resonate with different communities. In a recent grant we received from the Office of Women's Health to develop a media campaign, we conducted a focus group with our partnering CBOs and learned some really interesting cultural nuances. So what was interesting was for our Hindi partners, they preferred a poster of a girl pleasantly smiling, who you see here, and they felt that that would resonate with the population and make them feel comfortable. And then for the Burmese, Chinese, and Vietnamese populations, they preferred a photo of a man that has a stern look on his face, as they remarked that hepatitis is a serious issue and that a photo is more reflective of that. We recently developed a PSA to help raise awareness about hepatitis burden in the Asian community and the importance of getting a vaccine to prevent infection. CHWs from our partnering CBOs were invited to participate because we wanted the hepatitis message to connect with the community. We're excited to share this PSA with you. So just give us 1 second while we pull it up. All right, 1 second, I apologize.
Hepatitis B attacks the liver and is 50 to 100 times more infectious than HIV. In the United States, 1.5 million people are living with chronic hepatitis B.
And nearly 750,000 are Asian Americans.
1 in 10 to 12 Asian Americans has chronic hepatitis B.
And this is the largest health disparity for Asian Americans in this country. But it's also a vaccine-preventable disease, so let's do something about it. Get educated and be informed. Get tested with a simple hepatitis B screening. Get vaccinated to protect yourself and your loved ones. And most importantly, don't let hepatitis win. Don't let hepatitis win. 여러분, 비형 감염을 예방합시다.
让我们战胜肝炎.
Chúng ta phải chống lại viêm gan. Nên again, it's head and cavity lung cancer.
ผมจะคิดว่าเอาโรคเอาชนะการรักษาโรคตับได้
비형 감염을 이기세요. Không ai rốt làm chứ nhé. मैं hepatitis को जीतने नहीं दूंगी. Don't let hepatitis win.
Okay, hope you liked that as much as we did. So, next I'll discuss the fourth sector in which we partner with, which is ethnic media. So, especially in marginalized immigrant groups, ethnic media is often the voice of the community. They write and report what's most important in that specific community, and also radio and newspapers are disseminated broadly and widely used by the community. It's often in their language, it reflects their interests and culture. Throughout our programs, local ethnic media has helped publicize hepatitis education and screening events, as well as town hall forums. They've disseminated public service announcements and have been the venue in which we've shared personal stories of the impact hepatitis has on vulnerable communities. Here's a couple of newspaper articles in the ethnic media that have reported on our events. The first article was written by the Laotian community, and the second one in the Korean local newspaper. And finally, our last sector is healthcare providers. It's key to involve healthcare providers in our efforts to decrease rates of hepatitis B in our communities. Providers serve as a critical link to connect communities to prevention and to care. It's important to identify providers that already serve your target population and partner with these providers because, first of all, they know their community best, and they provide vaccines to those who are susceptible as well as treatment to those who are chronically infected. In 2010, Asian Health Coalition designed a physician resource directory listing over 70 physicians throughout the Chicago area. The directory was designed to help the community find the latest information on Hep and physician resources. The directory includes physician contact information, the types of services they provide, the insurance types that are accepted, the language capabilities they offer, and, of course, whether or not new patients are accepted. In establishing partnerships with all our key stakeholders, we've learned that there are some essential components to our partnerships. It's important to understand each organization's strengths and limitations. While one organization may have a strong relationship with the community and be able to recruit many participants to the event, they may have limited staff members, resources, and volunteers to help with an event, for example. Or another community may have great facilities to hold a town hall event, but they may not have the strongest relationship with the community. So next, so that you and your partners are on the same page in way of roles and expectations, it's key to establish clear objectives. We write memorandum of agreements with all our partners in which the executive directors or medical directors sign. These very clearly lay out our different roles and expectations. Also, we all need to have crucial understanding of healthcare needs and trends in the community. So, for example, the Burmese have especially high rates of Hep B, but are often screened and vaccinated when they enter the U.S. as refugees. So it's important to know that kind of stuff. It's important to know that and decide who needs screening and who has already received the vaccine. Lastly, because it's often difficult to access populations that are underserved, you must have a personal passion and commitment to serve the community's vulnerable populations. Before we close the webinar, I'd like to direct you to our online manual and additional tools and resources that we've developed. From our experiences, we've created a manual which describes our model thoroughly, which you are welcome to look at, and you can adopt pieces into your own settings. We have a wide variety of tools and resources described during the webinar, and then we also have additional ones that you can adapt that and fit to your community. To gain access to these programs, simply go to this link and you'll see our manual categorized into sections. It's right here, yep. Into sections on the left-hand side and the corresponding tools and resources on the right. If you have any questions about how to build or sustain partnerships, or about how to adapt any of our strategies into your community, please feel free to contact me using this contact information. Remember, we will be archiving this webinar on our website, and we'll make sure to include the link in a follow-up email that will also include a survey. Please make sure to complete the survey. Your feedback is so important to us. Now we're opening up any questions that you may have to Dr. Kim and myself, and we'll answer them as best as we can. Feel free to type in any of your questions here. We'll give you guys a second. Okay, so the first question I see is there a YouTube link to the PSA? So there is one. If you go to the Asian Health Coalition YouTube channel. So we can definitely, in our follow-up email, include that link. It's also included on our website. Okay. So I see a question here. That asks what's been the biggest barrier in reaching out to CBOs to develop partnerships. You know, to be honest, fortunately our partners see Hep B as an issue. So they're often glad to partner with us on our Hep programs. At times recruitment is difficult If, for example, the community didn't choose the right time of day or the right day of week, or, but usually they've been really cooperative, and not only cooperative, they have such a great link to the community, much more um, than we would have from our position. So they're housed in the community sees them for different services, and they have personal relationships with everyone. So they follow up with clients and make sure they're up to their follow-up visits. We've even had stories of people going to follow up like doctor's clinics with them, which has been really helpful. So I see a question here about, can you share an example of an MOU, a Memorandum of Agreement? We'll show you that right now, actually. It's right on the website. If you go here to Asian Health Coalition, what we do, and then you see Viral Hepatitis Community Manual, and then you'll see all of our sections and resources. The resources are on the right, so you can just kind of scroll down, and let's pull up the Memorandum Agreements. Okay. So this kind of gives us some great tips and pointers and examples of an MOU. It's in section 6. So another great question I see. Can this model of community collaborations be adapted to the community that aren't Asian, to a community that is not Asian or African? While many of our strategies are targeted to underserved communities in general, especially those that are immigrants and refugees, so the strategies can often be applied to different communities. So I'd say that yes. And you can very much pick and choose exactly how you use our model and completely adapt it to your own organizations and communities. I see another question. How have you recruited CHWs? So community health workers are often staff members of our community-based organizations. So so when we partner with our community-based organizations, they're the ones that help us identify and recruit people in the community that we call them kind of like mayors of the community. The best CHWs have been those that everyone knows and feels comfortable with, and that has, that's obviously very bilingual, and can really connect with the community. I see another question. Are your materials able to be adapted and used by other organizations? Absolutely. So our materials that you have complete access to online, they can be adapted and used exactly how you'd like. We're all about sharing here. All right. I see another question. Is there a specific, how do you develop and maintain partnerships? So we've kind of built our relationships with our partners over the last 15 years. So while some of them are new, many of them have been established. When we do have new partnerships, we definitely make sure we spend a lot of time, especially at the beginning, to visit our partners, understand exactly what they do, how they serve the community, before we kind of just throw them into our programs. Here's a great question. Have you ever encountered a language barrier when working with a local ethnic media? Fortunately, the staff that we've worked with at ethnic radio and newspapers, they've been bilingual, so we haven't really had that issue. But we can imagine that this is an issue. In that case, I guess I would recommend that people would work with, that you'd when you work with ethnic media, you'd make sure that you're with someone who is bilingual, and then can communicate with the ethnic media staff. And Dr. Kim, please at any point feel free to chime in. Okay. And I see a good question here. What are the best ways to identify local government officials to develop partnerships? That's a good question because it's often difficult. Government officials are often hard to access. So our partners and board members who we've worked with over the last several years have often connected us and been our link. Sometimes they may have had these relationships for years, sometimes they're newer, but they usually are our best link, especially if they live in the community where the local government official works. And then also there are times when we blindly have reached out to government officials, and that surprisingly has worked well for the most part, as long as we're explicit enough in our ask. Ooh, this question makes me happy. Can you give more details as to how you've developed your physician resource directory? So how did you find information? How did you disseminate it? How did you disseminate it? This is also in section 5 of the manual, and we describe exactly how we developed this resource directory. First of all, we used just a basic search engine to identify physicians in the area that we were targeting, and one of our staff members spent significant amount of time verifying that verifying information via phone. So she called clinics up, asked them what languages they offer, what language services they offer, what kind of insurance they offer, and so on. And then we just compiled the info and created the document. This is an interesting question. How do you maintain momentum for a program that, hold on 1 second, let me scroll back up to that question. How do you maintain momentum in a project that has been active for so long? It's interesting. I think that a lot of our community partners have see a great need in their communities for hepatitis programs. It is such a huge disparity in the Asian community. So while this program has been going on for a long time, I think there's still a need for growing awareness about the program. So even just a few weeks ago when we had a screening event, we had some participants come up to us and tell us that they're so excited to have this program because they didn't know before hepatitis is such a big issue and they're only now learning this. So I think that when we hear those kind of personal stories, it's very inspiring to us and keeps us going. Do you have partners in place for follow-up in case if someone who is screened has Hep B? Yes. So we actually right now are working on a program to screen and link those who are susceptible and positive to care, actually specifically positive, and we have a list of clinics that we work with, and we, just like in the physician directory, we've gathered information on their language capabilities, the insurance that they require, and then we share that with our community-based organizations, who then works with the client individually to get them to care. This program is especially exciting because we make sure that people get followed through the entire way through. I see another question. How often do you use CBO partnerships for translating materials versus a professional translator? We actually have all our materials translated professionally, but we do ask our partners to review and review these documents, make sure they're translated well and that the translation makes sense, because sometimes when you translate things into a different language, the wording is slightly off, so they just make sure it makes sense. Here is a very good question. How do you handle partners who have been challenged in recruiting and screening participants? So we understand it's sometimes challenging for partners to recruit participants due to conflicting priorities. When partnering with clinics, for example, physicians focus on immediate health issues, which is, I think, a common thing, and it's sometimes difficult to get them to do preventative care work such as screening. So we just continue working with physicians, trying to raise awareness and kind of buy-in from the physicians themselves. And through ongoing work, we see it slowly changing. How often did you meet with CBOs to develop materials and framework for hepatitis education community events? Well, now that our program has been running for years, we don't have scheduled meetings per se to develop materials, but we do meet on an ad hoc basis with most of our partners. For the posters that you just saw earlier in this webinar, we held a focus group to get feedback, which we had shared with you also, and we helped record this PSA. And then that was about 3 or 4 weeks ago, and then I guess we're meeting again next week to celebrate Hepatitis Awareness Week and have a celebration and show the PSA and share the posters with them, since they really helped us develop them and make sure they're appropriate for the community. I'll just wait a bit longer here. If you guys have questions, please go ahead and type them in. Okay, this okay, I'm just going to wait I'm just going to wait another few seconds here, but you guys have some really good questions. So I'm going to show how to get the materials online. Someone here just typed, can we look at that again? Okay, so in the webinar, we provided the link, which you see here. You go to our website. Another easy way to do it if you don't have the link, you just go to asianhealth.org and you see what we do on the left. Go to viral hepatitis. Go to Hepatitis Community Manual, and there's our PSA. That's another way you can get to our public service announcements that you just saw. You click on Hepatitis Community Manual, and you see again on the left-hand side, excuse me, the manual broken out into little sections, and then also additional resources on the right-hand side. So earlier, someone had asked how they can look at a MOU. That would be on the right-hand side. Yeah. There's other examples here there's job descriptions, there's our community health worker model, fact sheets, posters, presentations. You can get through all of this on our website. Also, we have I want to make sure everyone knows that They can have the physical manual as well if they're interested. They would just email me, and I would make sure to get that sent via mail. We've distributed that to almost 200 departments of public health, academic partners now, and they found that very helpful. So that has that explains not just what we talked about today in terms of building partnerships, but also other aspects of our program. Okay, I see another question. Do you ever run into concerns people have with Western versus non-traditional medicine? That is a great question. I actually personally haven't yet. However, I'll definitely get more feedback from other staff members and include that in our link. How do you build an academic partnership if you don't have an existing content? So many of you have probably already experienced having to call people blindly to build partnerships, and this is something that we prefer not to do. We tend to try to find a connection with a partnership, with a community organization or whatever sector we're hoping to partner with first. And usually, even with a city as big as Chicago, that is, has so many organizations, usually one of our Asian focused partners has a good connection with a partnership, so they kind of help link us, connect us. What is the age range for screenings? So in this particular, right now the program that we're working on, it's important that everyone is over 18. And the reason is a lot of times when people come to the U.S. As adults over 18, unless they are required to get a vaccine for their job, they're really not required to get a hepatitis vaccine. Whereas if you're younger than that, to remain in school, schools require vaccine information. It's required that all kids are vaccinated. So that's why we're more targeting adults with this. So any advice for how to recruit for screenings? So this is where our community-based organizations kind of come in best. They have such great relationships with their communities. So our community-based organizations provide services, often like ESL classes. They have like senior services often. They have like legal services for immigration, and they offer a variety of health programming, sometimes like diabetes prevention. So they already have so many clients coming into their organization, so they often recruit people for screenings that way. Sometimes through flyers, sometimes through word of mouth, sometimes they call them. But really, we give a lot of credit to our community-based organizations to recruit our participants. I see a question here. Are you available for help and assistance with adopting the model to our organization? Absolutely. So if you look again on the webinar, which will send you a link to, you have my contact information. I'll give it to you again. My phone number is 312-372-7070, extension 225. And also my email is just mona@asianhealth.org. So you're very welcome to ask me as many questions as possible. And if I don't know them, I'll link you to resources. Any other questions? Are there policy implications from the data you've collected? So whoever asked that, if they could just clarify the question, that would be really helpful. Okay, so one more question I see here is any opportunity to talk to legislators about how big the problem is to get more resources directed. Yes, that is when actually the local government plays a key role. Um, it's so important since we really are on the same page. Our local government, um, has priorities to improve the health of the community, and so we often through press releases, through sharing our PSA. For example, we just sent this PSA to Dr. Shakir, the Commissioner of Health at Chicago Department of Public Health, and we're sharing it with others, so other local government leaders, and so yeah, we definitely share all our information with them. And earlier you saw Senator Danny Davis spoke at our breakfast dialogue last year during Hepatitis Awareness Month, and so that's another example that we definitely engage the local government. Okay, so we're nearing 45 minutes now, and unless people have some questions that they're just going to ask right now, we're going to close out, but thank you so much for participating. Again, we will send you a follow-up link. Please make sure to fill out the survey. It's really helpful for us to get feedback. And you're welcome to view the webinar, our public service announcement, our website's all on there. You're welcome to contact me. Okay, thank you so much.